Up first on the show, the good news. The number of new COVID cases reported across the globe has declined for a fourth week in a row, according to data from the World Health Organization, offering a glimmer of hope that the world is turning a corner in its efforts to contain the pandemic. The number of COVID deaths reported worldwide decreased for the second week running, with 88,000 new deaths reported last week. A 10% drop compared to the previous week, according to WHO, and more than 3.1 million new cases of COVID were reported around the world, the WHO said in its weekly epidemiological update. That was a 17% decline from the previous week and the lowest number of cases worldwide since the week of October 26, 2020. Now, the other big focus on our show today, a look at Kerala. The maximum COVID cases reported in India are from Kerala. In fact, on Monday, Kerala also for the first time overtook Maharashtra in the total COVID deaths in the day, becoming the state with the highest number of daily COVID deaths. Now, despite the high number of cases, Kerala's case fatality rate, that is the CFR, is amongst the lowest in the country at 0.40%. So that's good news. But from the early stages of the pandemic, Kerala received national and international acclaim for the early success in controlling COVID. So it's only ironic that Kerala now faces the worst COVID situation in the country. Well, to talk more about the situation in Kerala, we're joined by Dr. Muhammad Ashil, Executive Director of Kerala's Social Security Mission and core team member of the COVID control team there in Kerala. Thank you so much for joining us, Doctor. Really, that's the question on everyone's mind. What went wrong with Kerala's success story?
Actually, it's the other way around. Actually, we are facing what we did right, actually. So to look at it, as you said, it's ironical. It's a bit ironical to see that the state, as it performed good, it is actually facing the blend of that. To see, let me put it in numbers actually. So when we look at the seroprevalence study of which was done by ICMR in the last month, what they found is that in the average seroprevalence of COVID-19 in India is around 21.4%. And that of Kerala is 11.6%. Even after being the first state to report the case, we are now also 88.6% of the population is still susceptible for an infection, which shows that we have been successfully able to delay the peak. So the other part of delaying the peak is that even when the entire country, entire nation has gone like this, our peak may actually be dragged down, or dragged too much, so that in the end you may feel that at any particular point of time. Now, when you look at that, when most of the part of the India has covered this, completed their epidemic in a way, or have actually came down, now we are on the upper side, or we are on having a high number of cases. Let me put it in another perspective. When we look at the cases, for example, the cases across the nation, for example, Delhi, classical example is Delhi. So how did the cases came down in Delhi? Is it because a new restrictions was brought down, or if it's because something new things have happened which actually led to the decline of the cases? No. What happened is a natural decline. How this natural decline occurs? When a particular percentage of the cases, for example, though the herd immunity threshold is around 60%, when the 30% of the cases occurs, the decline happens. Now you need to look at when even the reported cases are a very deceiving thing. When you say that the number of cases or the case per million, or for example, the number of cases is high in Kerala, you need to look at the seroprevalence data. You see, when in India, when you say that 21.6% of the is infected, if you put it in numbers of adult population who are infected, that comes around 22.1 crores. And India is reported around 1 crore cases. So for every 22 cases, only 1 case gets reported. Whereas that of Kerala is that we have reported around 10 lakh cases, and our seroprevalence show that we may be having 30 lakh cases, which says that 1 out of every 3 cases are reported. So there is a clear surveillance bias.
All right.
22 cases on one end. And the other end is that what did we achieve on delaying this peak? What did we achieve on delaying the peak is that, one, why do we delay the peak? To see that our health system capacity threshold is not overtaken at any moment of the time. And if you look at our data, we have occupancy data for each of the ICU beds. And
all right, so Dr. Ashil, what you're saying is that you managed to control the disease, and even though the cases currently compared, to what's coming up in other states seem to be high, that you managed to delay the peak, and therefore you've not faced the crisis that other states have faced in terms of hospitalizations, etc. That's the point that you're making. What steps are being taken now to, control the spread of the disease? Recently, you had the 2 schools that had opened. Class 10 students or 200 students got coronavirus, and it led to a lot of contact tracing, etc.
Yes.
Also, there was some research going into about the variants and what the infection that is spreading in Kerala, if there was anything different from the rest of the country.
Yes, it's a beautiful question. Actually, what we are doing at this time when we live with the virus, what we need to do is that we need to do an intelligent iteration of lives, livelihood, and our health system capacity threshold. So when we release our livelihood to happen, for example, we open the schools, we open the theaters, we open the facilities, we open the market, we are looking at whether case fatality rate is increasing or not on one end. And the other end, what we are looking is our health system capacity threshold, if it is actually overwhelming. So what we need to do, we need to look at the occupancy. Now the occupancy of ventilators is 14.8%, less than 15%, and our ICU bed occupancy is 48%, that is less than 50%. So when in any location, if the cases are increasing high and our it is reaching our health system capacity threshold, we clamp the places and reduce the livelihood perspectives there. And now look at the schoolings. We need to every decisions in this based on risk and benefit analysis. We cannot actually take arbitrary decision on it. It's not a competition. It's not a sprint. It's a marathon. Right. So we need to make sure that we are doing the right thing and not to play to the gallery. Well, now when we see, we have the lowest case fatality rate. We have the highest recovery among the closed cases. We have the highest recovery among closed cases. That's only relevant thing. And we have the lowest epidemic. To see, we have started the first case in January, and till now we have only 11.6% of the population, and we have the highest detection rate at 1 out of every 3 cases. And the most beautiful thing which we found last day is that we did an excess death analysis to see that whether we have missed any deaths. So last year deaths, that's the 2019 deaths, were compared with the 2020 deaths, overall death. And we were astonished to find, and we were actually happy to find that this year we had a 10% decrease in the death, because 28,500 deaths decreased this year. And that is attributable, very small portion of that is attributable, that is around 800 numbers, that is attributed to the decreased number of vehicles on ground. And many other things is attributed to our Break the Chain campaign. That is, we have followed a kind of soap mask and social distancing, so that many other infectious diseases also came down, and our health-seeking behavior also changed. So looking at now, we have done a tremendous job, and our health system has done a tremendous job. And now we are not really concerned on how many how other states perform.
All right.
For example, because this is
right. Well, Dr. Ashil, I'll just have to leave it there. But thank you so much for joining us. And so you're saying that don't compare Kerala numbers to the rest of the country. Look at Kerala by itself and how they've managed this pandemic so far. Thank you so much for joining us with that.
Thank you.
Now, the Health Ministry has said that India became the fastest country in the world to achieve over 70 lakh vaccinations against COVID. That's 7 million vaccinations. India accomplished this feat in only 26 days, while it took 27 days for the US, 48 days for the UK to reach the same figures, is what the ministry has said. More than 70 lakh beneficiaries have been vaccinated in India so far. Over 4 lakh beneficiaries were vaccinated just yesterday. Now, even as South Africa halted the use of AstraZeneca Oxford vaccine for not being effective against COVID, mild and moderate cases, the World Health Organization panel has recommended its use. AstraZeneca's COVID vaccine is safe and effective and should be deployed widely, including in countries where the South African variant of the coronavirus may reduce its efficacy, is what the panel said. The benefit of the COVID vaccine outweighs any risks, and that the shot is recommended for use, including in people aged 65 and older. Remember, some countries had concerns about the non-availability of data regarding AstraZeneca for those above 65 years of age. And staying with vaccine news, countries are now lining up for supplies of the Sputnik V vaccine, Russia's vaccine, after the peer-reviewed results published in the Lancet Medical Journal showed that the vaccine protects against the deadly virus about as well as the US and European shots, and far more effectively than the Chinese rivals. At least 20 countries have approved the inoculation for use. Sputnik V is expected to cost less than $10, around 730 rupees per shot in India. And Hyderabad Hyderabad-based Dr. Reddy's is conducting trials of the vaccine in India and went into phase 3 trials early in January. Well, to talk more about the Sputnik vaccine, we're now joined by Professor Nadi Hakim, President's Envoy, Imperial College. Thank you so much for joining us on the show. And it's been really good news for India, at least about the Sputnik vaccine, as we had already tied up to access it here. And it's been very positive news regarding how efficacious it is.
Actually, what I have to be impressed about is what you just said summarizes what has happened with this Sputnik vaccine. Initially, in November, December, we were talking about it and no one was listening. Everybody was saying, oh, it's a Russian, it's a Chinese, it's a, you know what I mean. Now, all of a sudden, when science has proven that this particular vaccine with the Sputnik is indeed very efficient as such as a vaccine and shows very high percentage of efficacy. Everyone now is trying to get it. And I do believe that it is going to be very popular everywhere. And the only problem is going to be how to satisfy everyone who wants it. I mean, over the last few days, I have to admit, I've had so many calls from different countries in Asia, in Africa, in South America, asking me how they can get hold of this particular vaccine, because it is indeed more efficient than most other vaccines we know about.
Though that initial skepticism was, because of lack of data offered by Russia, it was also seen to be some sort of a vaccine race and vaccine nationalism, with Russia trying to come out tops by announcing a vaccine which wasn't fully peer-reviewed then.
I mean, you're right in a way, but on the other hand, myself in particular, I was basing my input and my opinion about it on what was published in scientific papers. I mean, I'm a professor of surgery at Imperial, and I have no connection whatsoever with the Sputnik or the company. I have given a completely neutral opinion, basing my opinion on what I've read in the first Lancet paper. And as you know, there has been another updated version of the Lancet, which confirms even further the percentage of success of that particular vaccine.
And now we're hearing this talk of conducting, combination trials by clubbing the Sputnik vaccine and AstraZeneca vaccine to improve its efficacy. What can you tell us about that?
Yeah, at one point there was a plan to combine indeed the Oxford vaccine with the Sputnik vaccine together. Now this, I do not believe has happened yet, but this is the plan, or was the plan, until I believe the last figures we heard about the success rate of the AstraZeneca. Now, whether this is going to be implemented or not, to be honest, I have no information or inside information on this particular thing. But that by itself shows that scientists within the UK have given some credit to that vaccine, saying that it must be good enough, or actually very good, for them to even attempt to combine it to the Oxford vaccine.
Now, on the subject of the Oxford vaccine, there has been controversy over the Oxford AstraZeneca vaccine. You've had South Africa halting the trials of vaccine drive, citing low efficacy, and some countries have not allowed it for those above 65 years old.
Yeah, I mean, you have to remember the person who's going to get the vaccine is the patient. Anyone can say, oh, it's fantastic. But, when you publish figures saying it's 60%, anyone who is not a doctor as a patient would say, well, why should I take that particular vaccine when I can get let's say the Pfizer vaccine, which works at 92%, or the Sputnik, which works at 96%. So logically, you are giving the choice to patients and to countries now and governments to choose the one which is officially and scientifically demonstrated as the better vaccine. So, you can have the nicest car in the world, but if people do not buy it, it's not going to be good enough. So now that, let's say, the South Africans have cancelled, I think, the rollout of that particular vaccine, I'm not too sure what will happen to other countries. I know for a fact that one or two countries I deal with who were about to order the AstraZeneca have now put a hold on it and actually are trying to try their best to get the Sputnik instead.
All right, so a race really for the Sputnik vaccine. But another concern is about how, poorer countries are now being left out as developed countries are taking all the vaccine doses. And if we're to defeat this disease, we have to defeat it together. And for that, the entire world, the entire planet has to be safe.
Yeah, I mean, the poor countries, let's just talk about Africa, for instance. Africa is not necessarily a rich continent. There are some rich people, but the majority are not. So if you come to them and you say, well, would you like to buy something which is more affordable? Of course, they're going to be knocking on the door of the company, producing something which is much more affordable. I understand from reading the figures that, let's say, the Sputnik is selling for $10 or whatever a shot. In other words, when they are going to be buying a large quantity, they can supply it to many more millions than buying something which is like Moderna or Pfizer, which might very well be more expensive. So this is, I think, how it looks like, and I think we need to be the whole planet should be vaccinated because we are all one humanity. And I think we can't just vaccinate the rich and forget about the poor, etc., etc. And when you think about it, the poor, let's say, talk about India, you've got, sadly, a lot of poor people there, and they all live together, very close to each other. And ideally, you should vaccinate them so that that virus can be killed once and for all.
All right. Well, thank you so much, Dr. Hakim, for joining us with that. Now, very worrying comment from one of the top British experts. The coronavirus variant first found in the British region of Kent is likely to sweep around the world, and the battle with the virus is going to go on for at least a decade. That's what the head of UK's genetic surveillance program has said. The Kent variant has swept the country, and it's going to sweep the world in all probability. Sharon Peacock, director of the Covid-19 Genomics UK Consortium, has said to the media. Well, with that, time for us to slip into a short break. Coming up on the other side, we'll be joined by Dr. Suranjit Chatterjee to take our viewer questions. Stay with us. Welcome back. It's time now for our viewer question segment, and we're joined by Dr. Suranjit Chatterjee, Senior Consultant, Internal Medicine, Indraprastha Apollo Hospital. Thank you so much, Doctor, for joining us. Let's listen into that first question.
I'm Gurpreet Parashar from Gurugram. I want to know, what if an old person has heart problem or asthma? Can he still take the vaccine?
Right, doctor?
These patients, these are called comorbidities. Basically, somebody has asthma or hypertension or diabetes. These are called comorbidities. And you must be reading every day, and we are telling that people with comorbidities are priority candidates. So these are people who definitely require the vaccine. You can always discuss with your local physician or your treating physician, but these are candidates who have to take the vaccine unless and until really contraindicated.
All right, I guess people are a little worried, regarding any sort of reactions to the vaccine. Let's listen into the next question.
My name is Paxton Tony. I am from Chennai. Schools are opening up now. How will we know if coronavirus is spreading? Are measures taken by schools enough?
All right, so I think that's a big concern among school children and even their families with schools opening up, and whether they'll see a spread of the disease then.
It's a true concern. There's no doubt about it. So the schools have to be very careful, the government has to be careful, and the children themselves have to be very careful, because we have to practice all the preventive measures that we have been practicing for the last 1 year almost. So if we don't follow all those rules, the infection is going to spread. So all the three parties concerned, that's the students themselves, that's the children, the school authorities, and the government, all of them have to be really careful so that the disease doesn't spread once the school opens.
Right, and doctor, because we have families that live together, grandparents also live, with their grandchildren, so that is a worry as well.
True, absolutely true. Big people who are going out to work, or like people like us who used to come to the hospitals, we are always concerned about the family because we have elderly people staying with us. So that's a true concern which has been raised by this child.
All right, well, thank you so much, Dr. Chatterjee, for answering those questions for us. Well, that's all the time we have on the show. Do remember to keep your questions coming. Thanks so much for watching. Goodbye.